Hello, my name is Vanessa. We're here doing a neurofeedback session, and I wanted to introduce the very important topic of neurofeedback and how it can help you improve the regulation of your brain. So, we're here and we have our software ready. It is a software created and designed to help identify brainwave patterns that are functional and dysfunctional. Either we're overproducing or underproducing certain frequencies. These frequencies translate into symptoms, people having anxiety, people having ADHD, people having disbalance with their emotional regulation, and neurofeedback can help us with that. It's also excellent if we have any kind of sleep issues. So we're looking here at a screen, it's showing little bubbles. The bubbles are going to serve as a reinforcer for our client. And part of the reinforcement is letting know feedback to the client whether their brain is achieving the target frequency or not. If the brain is not achieving the target frequency that we set it up and program it to, it will show more bubbles. The moment that our client relaxes or focuses or has more emotional regulation, those bubbles are going to slowly disappear. And the word neurofeedback, if we divide it into two, it's neuro because we're working on the brain, and it's feedback because the client is receiving feedback in real time. There's other types of biofeedback, heart rate biofeedback, and skin temperature biofeedback, and other types of biofeedback. But the one that we focus on here is the neurofeedback because it's the one that has to do with the brain. So we have this cool technology for people to use and help them with their symptomology.
Well, we explain about the neurofeedback. I hope you have a better concept of what is neurofeedback, the tools that we use. We explained about the brain mappings and brain waves. And just to clarify, this is not as a solo treatment. It's a treatment that we have to do in conjunction with therapy, with pharmacology. It will improve the quality of other services the clients receive.
Beautiful. Yes. So we recommend that we do neurofeedback counseling. This does not affect if you're taking medication currently. That's a very popular question. And it's all used in conjunction to give you better, more efficient, and faster results in your recovery with any of your mental health symptoms. Also, Dr. Leon and myself are approved mentors through the BCIA. And for clinicians that would like to have more information on the 25 hours of mentorship that the BCIA requires, please contact me or Dr. Leon if you guys want to also be able to provide this wonderful service to your clients.
And explaining the neurofeedback therapy, it will take about 45 minutes to 50 minutes for an hour. So I dedicate an hour for this neurofeedback training. We can do short sessions, obviously. The normal session will be between 35 minutes to 40 minutes. So right now, as you see, the client is connected to an electroencephalogram device that we can connect up to 19 sensors in there. Okay. And we can do not only the training, but also brain map, but we're going to talk about in the next video about the brain mapping. Right now, the computer is collecting the information from the electroencephalogram, and then is directing to the computer and reset, like, when it's say instantly, and provide with the feedback. Okay. Through that, the software recognize the brain patterns that we need to modify, the client needs to modify, and to help the clients balance those pathways. After the feedback is produced and the client is able to modify these changes, the client modifies, it stays forever. It always improves. After we disconnect the client from the machine, the client continue making changes on his own. These changes are permanent. Obviously, if the client stop training, it will go back slash I was before, but never is going to be close the baseline the client has. So we have here in this brain mapping, we have 5 specific brainwaves: delta, theta, alpha, beta, and high beta. We're going to explain the ramifications of these brainwaves in mental health. Okay. For instance, delta, we produce delta during sleep. When we have high delta, indicates for sleep. Okay. And indicates a little bit of anxiety as well. Okay. So that's when we see these brainwaves in our clients, we have to focus on those. Theta is about memory, concentration, okay, distractibility. We focus on those in the clients. We try to regulate those when we find this regulated. Okay. So beta is a health thinking, emotional processing, health thinking, and we're gonna when we have beta, we focus to improve beta for concentration, improving emotional stability as well. Uh, alpha is for also alpha is for emotional processing, um, depression. Okay, we find the alpha dysregulated in depression, and high beta in beta is also for emotional processing, depression, anxiety. We also find a combination of these brainwaves in different conditions. For instance, delta and alpha and high beta for trauma in a specific frontal lobes and occipital lobes.
Hello, everyone. Vanessa here. We're going to talk a little bit about how we measure progress with a brain map, and then how we also measure progress when clients are doing neurofeedback sessions. Now, for the clients who use the brain map tool, we're able to compare the first and the second, or the third and the fourth brain map, depending on how many the client has. Usually recommendations are after, before they start their treatment and after they start their treatment, we're able to see. Neurofeedback works on 4 different areas, 4 different paradigms that we measure. One of them that's very important is magnitude. Magnitude is what lets us know as clinicians if a client is overproducing frequency or underproducing frequency. So we have the different brainwaves that Dr. Leon explained, and those brainwaves are within a certain amount of range. Now, if the brain is producing too little, like for instance, in this example, the brain is producing slower frequency, or a lower amount of magnitude, that is under arousal. Now, if the brain is overproducing frequency, for instance, the red areas, then we say that brain is overstimulated. Now, another very, very important part of the brain is how it connects, how the different parts of the brain are talking to each other. This is a very unique thing with neurofeedback, is that we're able to enhance the interconnectivity. That's very important, because if the brain is not connecting and not talking to the different parts, then we see that there's a lot of symptoms that come from that. So we, aside from the magnitude and the interconnectivity, we're also looking at asymmetry. Asymmetry has to do with the right and the left hemisphere and how they're functioning. Sometimes we are functioning at a higher level on one side versus the other side. So it's very important that the hemispheres are within balance, and asymmetry also allows us to know if there's balance. Go ahead and go down more, all the way to the bottom. Mm-hmm.
Keep going, keep going.
Okay. So right here, we're looking at the asymmetry. And we're seeing if, this particular client is using more of her right or her left hemisphere, and what areas specifically would we need to target to help the client with their asymmetry or help their client with the interconnectivity and also the dominant frequency. So, four core areas that neurofeedback addresses: magnitude, how much and how little; interconnectivity, how the brain talks to each other in the different parts; asymmetry, how balanced the right and the left hemisphere are; and dominant frequency, how much of a brain wave are we using in a specific area. Now, these are very differential things that we're looking at in comparison to other treatments. With neurofeedback, we're looking at those little electrical signals that help the brain unite and help us use our full potential and our full capability. It's very important for us to also incorporate other treatments such as counseling and medication, and both do not affect the outcomes of neurofeedback. Neurofeedback is here to help other treatments that clients are participating in, and altogether you get a much more efficient and fast results with the alleviation of symptoms.
Okay. Um, through the bubbles to watch the movie. Okay, that's gonna be your task. Um, the more you concentrate, the more you relax. Um, those bubbles, all these bubbles around the movie and around the movie are going to disappear. When you make changes in your brain activity and you start regulating the settings that I have in my computer, those settings requires do you need to make more of certain brainwaves and you need to make less of other brainwaves. This is going to create a regulation of this dysregulated brain activity that correspond with your condition. So when you're able to regulate this brainwaves, the bubbles are going to disappear. Okay, so you're going to listen to the movie through your headphones, and you're going to be able to watch the movie and concentrate. So I'm going to start playing the movie. Another important area of a neurofeedback, we talk about all the mental health conditions, but another important area about neurofeedback is neurofeedback with clients that have addictions. It is an important area that neurofeedback has a tremendous improvements in clients' quality of life. By working in specific brain waves, the clients report they have less cravings, more emotional control, and in conjunction with other therapy, the improvement in the quality of the recovery improves dramatically.
All right. Hello, everybody. We're going to talk a little bit about some of the side effects that people report when doing a treatment of neurofeedback. Now, in the beginning, because our body is not used to doing neurofeedback, sometimes people report more side effects when they're starting neurofeedback. As the body starts to get used to the treatment, those side effects start to decrease. Now, it's very important that we communicate with our clinician when we are experiencing side effects. Some of the side effects that people report that are most common is feeling tired or fatigued. Sometimes people report headaches. Other people report nausea. Some people report a little bit of dizziness or lightheadedness. And other people report feeling a little bit drowsy. So, if we have any of these side effects, it's very important that we report them. And then your clinician can adjust the protocol that they're performing with you. So, if you have any questions about side effects, you can refer to us as clinicians to clarify why these happen. Some of the reasons why people report side effects is either because they're overtraining, so you're spending too much time training your brain. Sometimes it's just because it's new. Sometimes it's because you might have not slept very well the day before, but these side effects are very minimal. And once again, it's just very important that you communicate with your clinician.